Hello everyone in India, and first I want to thank the organizers of Indian Society of Lifestyle Medicine. This has been an amazing undertaking. The team, some of you, most of you I've met or talked to you over the phone, but I want to congratulate the board of directors for putting this meeting together in India, a much needed organization. As we all know, lifestyle is medicine. It is not as medicine, lifestyle is medicine. And I'm happy and proud to be a part of this organization. And I'm honored to be, asked and to be a part of, one of the speakers here today for this meeting. And I also want to thank the audience for taking the time and out of your busy schedule and coming to this meeting. And I attended my first lifestyle medicine meeting only a year ago, and I attended mine at the American College of Lifestyle Medicine a few weeks ago. And as a matter of fact, just opening up my eyes into the whole paradigm of lifestyle medicine and joining the college has been the most rewarding professional thing I've done since I entered medical school 30 years ago. So in preparation for this talk, I was asked, or I was suggested to work on a title, Reversal of Heart Disease, Myth or Fact. That's what we're going to talk about. It's a loaded title. We could spend a good couple of weeks going back and forth, but I have 40 minutes. What I would like to start with is my personal story. I'm a guy who makes a living blowing up stents in the coronaries. How did I get picked to talk about reversal of heart disease? That's my livelihood. I make a living treating this disease with the contemporary way of medical therapy or blowing up balloons and stents in human coronaries. That's what I do. How did I get into having a title, not a title, a phrase, I have a carrot and a stent, you pick. How did that get on my white coat? How did that become my tagline on social media? So about 4 years ago, on a day what I call routine, I just sat down to do reports after doing about 6 or 7 procedures. And I noticed that for the first time, I have no idea why I did not ask the question before. I don't know why I asked the question that day, but I'm glad I did. The question was that all my patients that I worked on that day for stenting or doing a heart catheterization had the perfect combination of risk factors such as high blood pressure, diabetes, high cholesterol, obesity, and various other risk factors, and which are commonly seen in people with vascular disease. And the question that I asked that day was that if we are treating them as per guidelines, why are they ending up on my cath table, laying half naked, and I'm doing invasive procedures on them? Am I really treating them? And the answers to those questions were very unsettling. To a point, I actually felt a sense of guilt, thinking that, did I get my entire career wrong? Because these people were not neglected. We are, I'm affiliated with a full-time academic medical center, and we are treating them as per guidelines. And if we're treating them for guidelines, one, are we doing the best we can? And as patients and society, are they doing the best they can? So out of which was born an urgent need to reinvent myself. And every path I looked, they all led to various components of lifestyle, more so nutrition. That newfound, kind of awakening in itself was even more scarier, because I found myself completely void of knowledge and formal training. And that's when I started reading books written for lay people, because there was no book on lifestyle medicine for doctors. So that's my journey, and that's what led to reading books. And once I realized it, started talking to patients, started talking to my colleagues, started organizing some lectures. And here I am, talking to my friends and colleagues in my motherland. So that's kind of my story in a nutshell. And the American College of Lifestyle Medicine had asked me a few months ago to write an essay about it, and we published it in American College of Lifestyle Medicine online, and with the same title, that I, as an interventional cardiologist, I have a carrot and a stent, you pick. And with that said, let's jump right into our discussion here today. Is the current status of cardiovascular disease burden in India, and what can we do about it? And if we look into the recent past, just at the turn of the century, cardiovascular disease now has become the number one leading cause of disease, death, morbidity in India. And this was not the case. When I left India in 1994, the things were just getting to change towards this direction. But over a short period of time, within my lifespan of leaving India and coming to practice medicine in America, things have changed drastically in India. And compared to rest of the world's population, an average Indian is getting diagnosed with coronary disease or any vascular disease 10 years earlier. And if you look at the rest of the world and look at people who die before age 70, 23% of the world's population dies before 70 due to cardiovascular or ischemic heart disease. In India, it's 52%. And case fatality rate is also much higher in India. And like I was alluding to a few slides earlier, there has been a huge epidemiological shift in a very short period of time. I don't think such a drastic epidemiological shift has happened in such a short period of time anywhere on the planet. There has been a 50% decrease in mortality due to communicable diseases. But at the same time, there has been a huge surge in diseases that are not communicable. Yes, we have gained some years in life expectancy, but that's allowing us to live longer, but at the same time also making us live longer lives that are sicker lives. So we are adding years to our lives, but I think we are falling behind, or we are falling short in adding life to our years. And the cost, besides the human cost to loss of a loved one to a family member, that's not measurable. But what's measurable in terms of productivity and a young person being a part of the society and contributing his or her own ways to build a society and build their own life, it's $250 billion have been lost between 2005 and 2015. That's a lot of investment. And 25%, 1 in 4 of all deaths in India are due to cardiovascular disease. In addition, compared to the rest of the world, where about 235,000 people for every 235 people for every 100,000 die due to cardiovascular disease, India is 272. And there has been an 83% increase. 83% of all cardiovascular deaths in India are due to primarily 2 reasons: stroke and heart attacks. And that went up by 59% between 1999 and 2010, in 11 years. Number of lives lost to cardiovascular disease went up by 59% in 11 years in India. And when I talk to my friends, I hear frequently that this is not the case in rural India. Rural India is fairly agriculture based, and people are still doing a lot of farming, which is all true. But if you really look into the nitty gritty of numbers, the numbers are actually quite telling and shocking. In a very short period of time, again, one maybe 2 generations between 1960 and 2013, there has been a 14-fold increase in cardiovascular disease burden in India, and a 7-fold increase in rural areas. That is shocking. And if the same thing continues, by 2015, we expected, it's already been passed, that there's been a 70% increase. From 1960 to 2015, there's been a 70% increase in cardiovascular disease burden in India. And if you really look at those patients with heart disease and those who have hypertension, 138% increase between 1990 and 2013. 138% increase. Why such a big burden in such a very short period of time? That's the pressing question here. Why a society that is very traditional, that believed in ancient ways of living, ancient ways of eating, through Ayurveda, to yoga, through meditation, through prayer, what happened in such a short period of time? To ask that, let's get into the risk factors. What's causing this much disease? And this has been extremely well established in this landmark paper called the Inter-Heart study that identified about 9 risk factors across all populations. And those 9 risk factors individually or as a group, the risk increases for every risk factor that we acquire, such as smoking, diabetes, high blood pressure, hyperlipidemia, especially the ratio between ApoB and ApoA1 lipoproteins. And these are one of the 4 the most important things. And then each one that you tag along, our risk as clearly shown in this slide, it goes exponentially higher for each risk factor that you add on to any one of them in combination. Now, smoking in India, close to in the form of, and again, a lot of smoking in India is the rural, the classic beedi smoking, and a lot of it is not accounted for. We may not really know. Even some of the statistics that we have may just be the tip of the iceberg. But by most recent estimates, some close to 30% of people are smoking or using tobacco of some form. And there are some states in eastern India, like Mizoram, their smoking rates are 67%, some of the highest on the planet. And one of the shocking trends compared to the rest of the world is that there's an increasing trend of pickup smoking in Indian youth. Next one is high blood pressure. This is uniquely different. Due to relentless campaign and public awareness, at least in the US and most of the Western world, the prevalence of hypertension has gone down. India is quite the opposite. The prevalence of hypertension in India has gone up. Again, very similar to smoking, 1 in 3 Indians have high blood pressure. I do not know a family member or a household that I know in India, or even in the US of Indian ancestry, where at least not one person is not taking a blood pressure medication. Every family that I know, there is at least one member who's taking an antihypertensive medication in that household. And if the same trend continues, we are on a path to double our hypertension prevalence by 2025, which is right in sight. Diabetes, this, as you all know, every doctor in India knows this because we are living through the wrath of this in India. And over the past 2 decades, within our urban population, the prevalence of diabetes is doubled. And it quadrupled. Although the absolute numbers are small, the proportionate growth has been higher in rural areas. Close to 17 million people are estimated to be currently living with diabetes. And it's expected to go to over 100 million in 2030. And the pre-diabetics, just as many pre-diabetics in India, 70 to 80 million people. Hyperlipidemia, only 20%, only 1 in 5 people have a completely normal lipids. And all of this data is actually done and compiled by epidemiologists in India. These numbers are actually shocking. And the overweight and obesity, 25%, 1 in 4 of us have overweight. And what's very common in India is truncal obesity. And one of the things that I read recently is that although an average Indian person appears to be lean and slim and would even pass a BMI test, one of the things if you're not already doing it, it's probably more useful in Indian subcontinent and Indian gene pool, is to get into the habit of looking waist to height ratio. If our waist circumference measured at the level of our umbilicus, if it is more than half of our height, it does not matter how fit we think we are, because that is reflective of truncal adiposity, which is directly related to many inflammatory conditions, not to mention cardiovascular disease. And the same trend is happening in our children. 19%, this is a pooled analysis of 52 studies from 2010. 20%, almost 1 out of 5 children in India are overweight or obese. And this is, again, I've been with every one of the social trends or the risk factor trends. Again, this degree of weight gain is a very, very, very new thing and happened over a very short period of time. and it is expected to reach 50%. 50% of Indian population could be either overweight or obese by 2022, which is only 4 years away. 50%. Most of us are not active. Less than 10% of the population is actually actively engaged in a recreational sport or any recreational physical activity. 50% of the population is physically completely inactive, period. And this data again is based on a survey of 14,000 plus people. The most debated one, and this is, the reason I say debated one is that when we as physicians talk about medicine and our area of expertise, we are the expert. But when we talk about food, although to me it's become science, I'm also acutely aware of the fact that food is also generations worth of habits, generations worth of recipes, generations worth of culture, ball games, sporting events, festivities. And in doing so, the minute we start talking about food, everybody is an expert because they're so deeply rooted and invested in what they think is good for them or what they think is being passed on to them from generation to generation. And it's very difficult to go through those barriers and have a scientific discussion. That's one way of looking at it. Another way of looking at it is that it also turns out we are the only species that needs a randomized controlled trial to eat breakfast. So a lot of this is actually common sense, and we are making too many of mountains out of tiny little moles, and a lot of it is common sense. And we'll go through the data here in a second. But if you really look at the dietary patterns, the fat intake, and I get into a lot of these discussions with a lot of my Indian and non-Indian friends and colleagues that, how come you Indians who are all vegetarians, all plant-based eaters, how come diabetes is going up? How come heart disease is going up? So veganism or vegetarianism or plant-based way of eating is not good because there's an Indian paradox. And I said, no, there's no Indian paradox because India is doing exactly what America has been doing for the past 50 years with our dietary patterns, because fat consumption has gone up significantly. People may not believe in this, but this is data from large Indian epidemiologists. That too, especially consumption of highly refined vegetable oils, hydrogenated fats, and trans fats has gone up significantly. And meat intake. India is now on its path to become the largest exporter of beef on the planet. As of now, we are number 2. We used to be undetectable. We are number 2. The only country that exports more beef than us in India is Brazil. And also, the pictures that you see here, that's a typical meal. When I visit India now, everybody's ordering chicken biryani for lunch and dinner. And highly oily, highly processed, and highly deep fried meats. And this has become a commonplace. And I don't remember it being like this in my short life, while I was in India for the first 25 years of my life. And another big problem is the consumption of refined carbohydrates and sugar. And as you can see in the graph, it's just skyrocketed. Young children drinking refined juices and refined carbonated beverages and ultra-processed simple carbohydrates. And this is actually shocking data. If you look at children who consume these items more than 4 times per week, children in India, 51% of children are consuming fruit juices, processed fruit juices, more than 4 times a week. That's a lot of sugar. And 21% of children are drinking carbonated beverages more than 4 times a week. 18% are drinking sweetened beverages. And here is, I've seen this. I probably have done a bit of this when I was a kid myself in India. 20% of 1 in 5 children are eating ice cream more than 4 times a week. No wonder the overweight rate is nearing 20% of our kids in India. Again, this is a beautiful paper done by, some of you know him, Dr. Prabhakaran, a legendary figure in the field of cardiology and epidemiology. He works very closely with the Global Burden of Disease Project. And one of the things, if you really focus on the last part of the slide, we can go through the trends from 1990s to 2016, but let's focus on where we are and what matters now. the bar graphs in blue are the global trend, and the bar graphs in red is India, and the bar graphs in gray are United States. So if you look at tobacco, India is doing worse than rest of the world and the US. If you look at physical activity, India is doing worse than rest of the world, and United States. And the dietary risk, that's the number one cause of, like I opened my discussion with, that in India, the dietary risk, and this is not just India, this is a global trend. Across the world, the Global Burden of Disease study has clearly shown this to us, that the number one cause of disease, morbidity, and mortality is now not infectious causes, not violence, not famine, it's diet. There are more people dying of overeating or eating wrong type of foods than undereating. So as you can see, the three most common risk factors, tobacco use, low physical activity, and dietary risk, unfortunately we're not doing well compared to the rest of the world. And same thing with high cholesterol, blood pressure, fasting blood glucose, and BMI. Again, if you go back to the far right of the slide here, under year 2016, total cholesterol in India, and it's in every parameter. The red bar is higher than the rest of the world, except BMI. BMI we're doing slightly better, but we are fast catching up, as you recall from the previous slides. Now, so this is the lay of the land. This is where we are. How can this be fixed? Can we fix it? Because continuing along this path is not sustainable at a personal level, at a national level, and probably more importantly so at a planetary levels. Because here is the deal. At the end of World War II, which I believe most of you can historically associate with, it's not ancient Greece, it's a recent past. At the end of World War II, the human population on the planet was 1.2 or 1.3 billion people. We in India are now 1.4 billion people. That's what I mean by our habits, the way we live our lives. It's not just going to impact us, our state, our country, but it's going to impact us as a race, a species, and as a planet. Hence, I say that if those of you in the audience, or your family members, your patients, or anybody listening, if you ever felt that you want to change the world, at no point in time do you have more power to do so than when you sit down to have a meal. That's how powerful these discussions are. Going back to risk factors and how can we change this? We clearly know that there are about 6 to 9 extremely important risk factors that contribute to cardiovascular disease. This is how it is in the US. I just want to show this. This is American Heart Association statistics that get published every year. All the risk factors that we just talked about are nicely illustrated under this bar graph. Only 9% of us are currently smoking in the US. Body mass index, 63% of people are doing fairly well. 40% of Americans are obese. But if you include overweight, that's about 70% of us. Most of us are not meeting the criteria for physical activity. Only 27% of us are meeting. Close to 75% of American society is not meeting the bare minimum physical activity criteria. If you look at to the far right, a lot of green in 3 bar graphs designated total cholesterol, extremely well controlled. High blood pressure, extremely well controlled. Diabetes, well controlled. This is data for 2017 put out by American Heart Association. They do this every year. So here is my question. If less than 10% of American society is actively smoking, and if our cholesterol, blood pressure, and diabetes are extremely well controlled for more than 80% of the times, why is it that heart disease is the number 1 killer? Now, draw your attention to the middle of the diagram here. For a bar graph that is labeled healthy diet score, there is not a pixel of green in it. People who meet the healthy diets criteria in American society are statistically undetectable. That's where we are. And this is probably true, maybe except for the blue zones. This is probably true for the rest of human race on the planet. This should give us a moment to pause and ask the real question: where are we going with this? Well, let's go back to the future for a second and listen to what this wise man once said. Thomas Edison said, "The doctor of the future will no longer treat human frame with drugs, but rather will cure and prevent disease with nutrition." He said this in 1902 or 1903. So let's go into each one of these risk factors and see where we are and what can be done. Lipid lowering. And this is not even an issue for debate. We know that for every millimole or milligram drop in lipid LDL levels, there is mortality. There's significant reduction in event rates. This has been panned out in Mendelian randomizations. It got panned out in randomized controlled trials with lipids, and even recently with the PCSK9 inhibitors. Lipid lowering helps prevent cardiovascular events. This is not an issue for debate. Now, extremely important point. This is a brand new paper. As you can see from this graph, majority of the risk imposed by high LDL or high atherogenic molecules in our blood, they accumulate before age 18. Majority of the risk. So most people are getting to an LDL of over 100 before they turn 18. So this is something I want everybody to think about when we feed our children. And an interesting way of looking at it, at any given age, you take your LDL and you multiply that with your age. You get a number called plaque years. And that number should not exceed 5,000. So LDL times your age, it gives you an amazing and a very simple way to quantify residual risk. So if you maintain your LDLs by healthy eating, predominantly a plant-based food, because there's no cholesterol, there's no LDL in a plant-based food. And you can maintain your biological LDL. For most humans at birth is around 50. So you can live to be 100 and not have a clinical event related to plaque rupture. So this is a new concept. It's not a new concept, it's an older concept, but extremely well put together in this very recent article from literally hot off the press less than 2 months ago. And so I kind of want you to kind of think of this equation when you see your patients. Is LDL times age. Keep that as long as possible. Keep that below 5,000. And the sooner we bring it down, the longer the lifespan without vascular events, at least from that one risk factor. So it can be controlled. So the key is to start early and keep it low for as long as we can. How do we do that? And this again is a landmark paper published by some really polar opposite people in the field. But when you put all of them together, they agreed upon one thing, that heart hypothesis, our diet heart hypothesis is a hypothesis in evolution. And over the course of last 50, 60, 100 years, from a very simplistic view that just a dietary fat causes heart disease, it's not that simple. There are a lot of complex interactions at play. But even today, the number one thing they're asking us, authorities, and I agree with them, is to cut down saturated fat. Cut down to as much as you can. Cut down saturated fat. And that's a dietary implication of this. Now, I spoke quite a bit about lower LDL. What are our options? As clearly shown in this nicely done meta-analysis, that LDL can be lowered by up to 40 milligrams on a plant-based diet. Hence, that should be one of the first approach. And the guidelines clearly tell us that before you institute drug therapy, except in the setting of an acute coronary syndrome, 6 to 8 weeks of therapeutic lifestyle changes. But most of us really don't pay due diligence to what that actually means. But this is what can be done. LDL can be lowered by up to 40 milligrams just by diet. And in a recent paper, American College of Cardiology paper, published in JACC, again, less than a couple of months ago, that it clearly saying that foods that are rich in unsaturated fats, particularly plant-based protein, with nuts, plant phenols, and high fiber foods can lower cholesterol by LDL by 30 to 40, and ideal strategy to promote the primordial prevention. So this is what we should be feeding our children: foods that are high in plant protein, diet that is high in phytonutrients and fiber. High blood pressure. This is more of a historic value. Late in the 30s, a German doctor, Dr. Walter Kempner, came to America as a refugee from Germany. And one of the things that he started lecturing at Duke. And he used to challenge that a lot of these toxins, these diseases that we are suffering from, his interest was in kidney diseases. He reasoned that these things are a result of what people are eating. Namely, so we could eradicate radically. We can make a radical difference by just asking people to eat food that saves lives. And some of his students challenged him. I said, "Sounds so cool, but prove it." A little bit of a historic perspective here. And years ago in the 30s, when Walter Kempner taught at Duke, he used to reason with his students that a lot of these diseases, such as high blood pressure and kidney disease, back then, hypertension was one of the major killers. They did not have proper treatment. And if you entered the hospital in the 30s with malignant hypertension, you didn't make it past 6 months. That was the natural history of hypertension back then. So his reasoning was that a lot of these toxins that are accumulating in the body, hurting our kidneys and leading to uncontrolled hypertension, are what we are eating. And during one of those lectures, and a group of his students actually challenged him, and I put it in this slide in quotes, is that Dr. Kempner, your logic and your theories sound cool, but prove it. So almost like on a dare, he put together a program called the Kempner rice diet. So he would take patients with highly uncontrolled blood pressure, with the numbers in the 200s. And he would institutionalize them, and he would feed them nothing but vegetables and boiled white rice. Absolutely no salt, if any. And within a matter of days to weeks, their blood pressure would drop significantly by almost to near normal or below normal. And then he took chest x-rays over a course of months to show that their heart size has normalized. He took their fundoscopic examinations, beautiful illustrations here on this slide. Their eye exam became normal. When some of this data was presented to major journals, they refused to publish it. They thought he was a quack, because this just doesn't happen. But guess what? That clinic is still open. Duke still has that rice house, still operational. And again, this is an extreme of an example to, in 2018, I don't expect anybody to go eating nothing but white rice and boiled water. But this is very telling as to what is the cause of this disease in majority of us. And now fast forward this to contemporary way of guidelines and hypertension and lifestyle. All these factors, eat healthy, exercise, don't drink too much alcohol, maintain ideal body weight. But when it comes to diet, one thing that we all know is the DASH diet. And it works. It lowers blood pressure anywhere ranging between 4, and I've seen in patients as good as 11, 12 millimeters in a few months. But what is not talked much about is Dr. Frank Sachs, who was the chair of the DASH committee under the guidance of National Institute of Health in the U.S. He published a few papers before DASH trial was put together. And the published data shows that the best outcomes with lowering high blood pressure was with a diet that is purely vegetarian. And one of the founding ideals, or one of the founding objectives of the DASH committee, was to create a diet that is as good as vegetarian diet. But DASH diet does include some, some room for poultry, fish, and some dairy products, primarily to make it palatable. And as educators and as men and women of science, our job to tell the public the scientific truth. And the scientific truth, if you really look into this, is a whole food plant-based diet with no additional salt and no added oil for a majority of people who are compliant with this and other aspects of lifestyle should normalize. I have a lot of patients whose blood pressure has been normalized in a matter of days to weeks. And the big one is diabetes. And famously, again, we can spend an entire day talking about diabetes and diet, but I'm just going to go over a couple of major trials. One of them is the diabetes prevention program. Compared in people who are at risk to become full-blown diabetics, when compared to placebo, metformin, lifestyle did better. And that lifestyle was to eat mostly a plant-based diet that's low in fat, and get down weight by about 7 to 10% of the body weight, and regular exercise of a brisk walking for about 150 minutes a week. If you did that, lifestyle had a better odds of preventing full-blown diabetes compared to a drug. And we know this from Seventh-day Adventist data that of all the dietary patterns, pure plant-based eaters, pure vegans, tend to have half the risk of becoming diabetics. Same was also shown in patients from or participants from the Nurses Health Study, is that if you have a high plant-based diet index over the course of many years, that you are less likely to become a diabetic than otherwise. And this is a randomized controlled trial by Dr. Bernard, that a 74-month follow-up comparing a pure plant-based vegan diet to American Diabetes Association diet. And the vegan diet outperformed the ADA diet. And at the end of 74-month follow-up, and some of the metrics are not exactly where they should be, but one of the limitations was at 74 months, only 50% of people were compliant. So it's not the deficiency of the diet, it's just the human nature. Just like with the medication works only when you take it. Same thing with lifestyle. This is not something that we do as a fad for a few days, because holidays are coming or you want to fit into a fancier new dress. This is not a weight loss program. This is a program of, how to stay away from my cardiac cath lab and not meet me in the middle of the night because you're in the throes of a heart attack. And so this is as good as this trial is. The limitation is that people were not compliant. And there's a nice meta-analysis that looked at a large number of patients with the dietary patterns, and then that concluded the same, that people who are predominantly plant-based eaters, whole food plant-based eaters, over the course of a long follow-up are less likely to become diabetics. And here is going back to the real question that I was asked to answer in a form of this discussion we're having today, is that can all of this plant-based stuff actually reverse heart disease, or is it just a myth? Right? That's the question that I was asked. So the first one, I'm going to go through 2 or 3 major trials, and a lifestyle heart trial. For this, I've said this to him in person, I say this in public. Dr. Ornish should be honored with the Nobel Prize for opening this up for us. It was the first randomized controlled trial to answer one simple question: whether the progression of coronary atherosclerosis could be stopped or reversed without using lipid-lowering drugs. Without using lipid-lowering drugs. That's a bold hypothesis. And what they did was they created a lifestyle program that centered around exercise, stress management, smoking cessation, and most importantly, group psychosocial support. It's kind of one of the underappreciated and under-talked components of lifestyle medicine as to how powerful the sense of belonging, the sense of community, and the psychosocial support is. And at the same time, they also avoided simple sugars and emphasized on consuming mostly complex carbohydrates and other whole foods. And the control group was asked to follow with their personal physician and follow whatever lifestyle or dietary changes they may ask them. And what they found out was that 91% of people at the end of 5 years were angina free, and there was angiographic reversal. This to me, as an interventional cardiologist, if somebody showed this to me, before my entry into lifestyle medicine or plant-based nutrition, I would have never believed this. But yet this was a landmark paper. And another paper from Dr. Esselstyn in Cleveland Clinic, 198 consecutive patients who are all non-smokers. Majority of them had hyperlipidemia. Close to a third of them had hypertension, and a small percentage were diabetics. And they were all being voluntarily asked to participate in the study and went through extensive counseling of plant-based nutrition. And the diet cohort was exclusively plant-based. And they were given supplements for B12 and omega and essential fatty acids. And what they found out was that at the end of close to 40 or 3.7 year follow-up, the 177 patients who were adherent to the lifestyle and the dietary plan, and this was actually mostly a nutrition plan. What is shocking is that the event rate of someone having a vascular event was 0.6%. And these are people with established angiographic proven coronary disease. And of the 21 people who did not adhere to the nutrition program, the event rate was 62%. And some of the angiograms that were repeated showed this degree of change, that from severe eccentric plaque with plus some thrombus looks like on it, they look normal. They look normal as if nothing ever happened to those blood vessels. This comes from India. I don't know why this trial does not get the popularity or the notoriety that it deserves. This is an unbelievably well done study. 123 patients, angiographically proven moderate to severe coronary disease, were asked to participate in a healthy lifestyle study where the nutrition part was low fat, high fiber vegetarian diet, moderate aerobic exercise, and stress management through Raja Yoga meditation. And what I don't have on this slide is, if you go into the details of the study, the patients were analyzed by a psychology team to evaluate their personality traits. The patients were also analyzed using their resting heart rate variability to see whether they are mostly parasympathetic driven or sympathetic driven. It's an extremely important component of how a person handles stress. All of that was factored in, and programs were tailored based on their personality traits. And the most salient feature was that the patients were made accountable for their outcomes. So it goes into, it's very interesting that I learned from reading this study is that the word healthy can be looked at as heal thyself. It is an inside job. It's very interesting that when you look at the English word health and the Sanskrit word swasth, they can be looked at in an interesting way, that it's all about self-empowerment, consciousness-based approach, being extremely mindful of every decision that we make, and ask the simple question, why do I want to be healthy? What is my reason? And I am being mindful about it on a daily basis, because every decision that we make is a direct, it's going to have a direct consequence on our health, longevity, and our time with our loved ones and our family, the things that matter to us the most. So now, what they did in the Mount Abu trial was that they would bring these patients in, and they would go through a 7-day in-house teaching, and of intense teaching of all components of lifestyle medicine, including meditation, including Raj Yoga, including walking program, and they would re-invite them every 6 months, and for reevaluation and also for advanced training in lifestyle methods. And at the end of 2 years, all patients had repeated angiograms. And what they found was that the people who were most adherent with the program, the coronary lesions regressed by an average of 18.2 millimeters in diameter. plus or minus 12. That's a lot for something to just disappear on a coronary angiogram by lifestyle. And 91% of patients had it trended towards regression. And more than half the patients, the lesions regressed by about 10 millimeters. And all these angiograms were verified, blinded by 2 independent angiographers. And the cardiac event rate, and this is the most important one, and the cardiac event rate in the most adherent was 11 events. And it was 38 in the least adherent, with a very, very, very significant p-value. Now, we hear all of this. I talked about every component, every risk factor, and angiographic data, that a lifestyle that is centered around a plant-based nutrition will literally lower the burden of every risk factor and the disease it causes. Yet, I am sure, including myself, everyone in the audience who has ever talked to a patient has heard this. Doc, this disease runs in my family. It's in my genes. As a matter of fact, it's on my both sides of my genes. So there's nothing we can do. Right? We have all heard this story. Exactly a year ago, at the American Heart Association meeting, the president of American Heart Association said these words: "There are no old men in my family. All branches of my family tree have been cut short by cardiovascular disease. I believe the people in this room have the power and even the duty to change that." John Warner, president of AHA. He said these words a day before suffering a massive heart attack himself while attending as the president of American Heart Association, was rushed to a nearby hospital, had, I believe, 2 or 3 cardiac arrest events, successfully resuscitated. And so this perception that there is so much in our genes that cannot be changed may not be true. And here is some data. Genetic risk. Now we have a polygenic score using DNA sequence polymorphisms. People applied this score to 4 different databases of prospective analyses whose cardiovascular events had already unfolded. But you go back and apply this gene analysis to these patients or these participants, what we found was that if you have a high genetic risk, but you chose to follow a healthy lifestyle, what is that healthy lifestyle? Is it something that's unattainable by most people? Let's take a look at the definition. You're not a smoker. Your BMI has to be just less than 30, not 24, not 25. Physical activity that you did more than 22 minutes of some kind of physical activity for more than once a week, and adherence to at least half of the shown dietary patterns. So then you are a healthy lifestyle person. So this is what they found out, that even in the setting of high genetic risk, if you follow that weakly defined healthy lifestyle, your risk of event rate went down by 51%. That's how powerful lifestyle is, that through epigenetic modulation, it can downregulate our genes. And now, just about 15 days ago, or 20 days ago, a new paper came out that looked at close to 300,000 Britishers, that looked at, same thing, people who have a very high genetic risk to have a stroke. But they chose to live a very healthy lifestyle, defined by the same criteria that I just alluded to. The risk of stroke went down by 66%, with a p-value of 1.19 times 10 to the power of minus 13. I don't ever remember seeing a p-value that is 10 to the power of minus 13. With that, I rest my case. Lifestyle is changing our genes to allow us to live long lives despite a genetic curse, if you want to call it. So, lifestyle is medicine, which is, I think, the current theme for this year's Lifestyle Medicine Conference in India. Healthy, heal thyself, and swasth, live a life that is centered our inner self and inner consciousness. And as a last and a final thought, and I truly believe in this, that even if our fate is written deep inside our genetic code, I truly believe to the core of my course that the code is written in pencil. With that, I'll stop and take some questions.